My name is Sheila Yahyazadeh. I'm the Chief External Operations Officer for CareFirst, Community Health Plan Maryland, right here in Baltimore. And I'm going to introduce a few of our panelists here, but I just want to say how honored we are to have you here. Following the thread, if you were a part of one of the panels we had yesterday, we also had the member testimonial, and there is so much power and truth that comes with that that really helps us understand how these solutions make it real for the member and the outcomes that we hope to accomplish together. So I'm going to pass it off to Don here to introduce yourself and maybe add a little bit about how were you first introduced to Scene?
Absolutely, I'm Don Gomez, and I received a phone call through Scene, and initially, I didn't want to take the phone call.
Classic.
I thought it was a sales pitch. I thought they were trying to sell me Medicare. I'm not quite there yet, so I was very resistant with that initial call. Yeah.
And we'll get into the why and then how we built up that trust coefficient a little bit later. Shantrease?
Hi, I'm Shantrease Holland. First introduced through a phone call, and it became somewhat curiosity with me. I was like, okay, let me see what you're trying to sell. So I'm going to listen, bring it on. And I listened to it and was like, okay, we're going to see. And I immediately said, no, thank you.
You're leaving me on the edge of my seat for what actually got you to the next step. Sebastian.
Yes, Sebastian Seiguer, CEO of Scene Health. Started the company about 11 years ago at this point, and roots are in public health departments of the company, but as a Baltimore native, I am just very, very excited to have the chance to talk to Dahjn and Shantrease, and our first health plan customer ever, CareFirst, who we started with about 7 years ago as our first step into Medicaid. So very happy to be here. Thank you for moderating.
Yeah, of course. So the why behind why we seek some of these solutions out is for us to be able to meet your needs. Yeah. In the time, in the space that works for you. So Don, talk to me a little bit about some of the challenges you were experiencing before you engaged with Scene and how you were managing your health.
Okay. I'm a mother of two. My oldest has autism, nonverbal autism, and epilepsy. So I am constantly working with her. I am her provider, take her out into the community. And so the day goes by where I may not eat, I may not remember my meds, I may not remember what my name is by the end of the day. So this made me stop and take care of me, because too many times when you're a caregiver, it's all about everybody else. It's what everybody else needs, and you're on the back burner. And it's not, sometimes it's when it's too late, when you're really at your lowest point is when you decide, oh, you know what, maybe I need to take care of myself. And Scene has prevented that from getting to that point. I'm very grateful for that.
Yeah. First thing you said was, when asked about your health,
yes,
you brought up your daughter.
Yes.
Right, yeah,
yes.
So. Exactly. So what was the tipping point? So you get a phone call. Tell me about that experience, because we've talked a lot about, in this space and other conferences, about how we're thinking about AI agents and AI bots. Tell me about the actual experience you had.
Well, I was pleasantly surprised that firstly it was an actual live human being. I think we've come away so much from, in our efforts to be more savvy, technologically speaking, this was a human being. Now the only problem with this particular human being was, I'm accustomed to some human beings who are asking me about what they can sell me. Do I need this? And one of the things that she took the time to actually know my name. My name is not spelled like anyone else's on this planet. Trust me, I've Googled it. So, a lot of times I'll get a call and my name is Don and it's Dahjn, and they'll say, hi, Dahjn, how are you today? And I'm like, well, my name is Don. So Dahjn, you're not listening to me. She took the time to listen to me. And that prompted me to start listening a little bit better to her. Yeah, really appreciative.
It's the personalization. I think we were talking a little bit about the prep of why that matters and that personalization that can be empowered through technology. And I know Sebastian will get to that a little bit later. Shantrease, so what was the tipping point when you got past the no thank you? What brought you back to Scene?
Well, at the time when they called me, I had a lot of death in my family. We buried 6 people in 5 months. I kept working, and I just kept going and going and going and taking care of arrangements, taking care of family, family that was still here were elderly, you know, and it was just like I was always on the run, going, doing. And they called me after I had that setback, and I got ill from neglecting myself, worrying about everybody else. I actually went blind in one eye. And my doctor was like, you need to grieve, you need to scream, you need to holler, you need to cry. And they called me when I was off. And I was like, let me see what they're trying to sell me. And so I listened and I said, no. I said, yes. And then when she said video, I said, oh no, I don't do the camera. I was like, oh, I'm sorry. She was like, come on and try it. And I'm like, and then I was like, I held everybody in the family accountable, do this, do that, take your medicine, do this, let me take you to the doctor's appointment. But no one did that for me. So this was like, okay, they're gonna make sure I take my medicine. If it's nothing but not wanting to disappoint them, I'm going to do it. Well, at least I said I was going to try it.
And you did. So tell us about that experience as you were trying it. What were some of maybe the aha moment or the moment of pivot that made you say, yeah, this is working for me?
I felt as though I didn't want to let them down. Like they were looking after me, which was a rarity because I was looking, you know, the caregiver has caregiven to them. That's very seldom. So it was like, oh, you're looking out for me. Oh, I gotta make sure I don't forget to do this. Now, I, again, don't like video, don't like pictures, don't like cameras. So it was like, oh, delete, let's try this again. And I just kept doing it, and I was like, forget it, they're gonna get me, whatever. And I'm like, here's my medication, here's me taking my medication. And if they listen to my videos, sometimes I was like, this medicine is nasty. I'm a 5-year-old kid. If it doesn't have blueberry, raspberry, strawberry, but I was like, at first I was deleting that. I was like, this is me. I'm sorry, that's all you're gonna get. But I knew that somebody was looking out for the person that looked out for everybody else. Family, friends, co-workers, everybody. I had people that were, hey, my little cheerleader. And I didn't know I needed it till I got it.
How do you react to that, Sebastian, hearing about it and sort of what we've created here?
Yeah, the problem that it addresses is medication taking, which for every chronic condition is a massive and very, very important thing. So the medications are excellent. If they're taken correctly and they're the right ones, then people get less sick, they feel better, and they work. And we already know that. But the problem is that they can be complicated. Life is complicated, a lot of things going on, and so sometimes people just need some help. And in a way, I'm not surprised because this is a process that happens for every single drug in America, for every single patient in the hospital. In the hospital, every dose gets administered with somebody else there to make sure right medication, right person, right condition, and that they react well. So the system was proven decades ago before there was video. It does work on video. And of course, at the same time, ask me how I feel about it. Yes, it's awesome that, you know, we're all in Medicaid for a reason. We want to help people be healthier. Right. So if there's real evidence of that, it's incredible.
Yeah.
It is.
And with just some global statistics, right, 50% of folks not adhering to medication, a quarter of those folks not even filling prescription, it translates to cost. At the end of the day, we have to understand how we improve health outcomes. Partners like SEEN help us put a face and a human touch to helping not only meet the obligations that we have to our regulators and to the state and to the metrics that we are held against, but more importantly to you all, in making sure that we're there in the time that it makes sense. So one of the pieces of SEEN is, we were talking a little bit about earlier, is, you know, digital health coaching makes it, almost undermines like what we're actually doing here. Yeah. So tell me a little bit about, Don, when you were filming these videos. When do they get sent in? Because it's more on your timetable, isn't it?
It was on my timetable, and my youngest daughter used to tease me because I would just literally stop everything and go, oh my God, I gotta do a video, gotta do a video, gotta do a video. And she's like, oh, really, a video? Mom, you really going all out for just a video? I'm like, yeah, because it became, I don't want to use the word, but I'm gonna use it, addictive. It was Instagram, you know, you have your medical team in your back pocket.
I love that.
Your medical team is in your back pocket. So usually when I need help through the nurse practitioner I normally use, You know, it's the patient portal, and you gotta wait till somebody reads it, and you gotta wait till it gets funneled to who it needs to go to, and you gotta wait till it comes back, and then hopefully you picked up the fact that they responded. This is, better term, instantaneous gratification, where I know if I put this video on and I say, hey, man down, I don't like the way this medicine's making me feel. I don't like, you know, I'm trying to take this, but this is what's going on. Even beyond that, I didn't feel like just a number.
Yeah.
I didn't feel like just my diagnosis. Yes, I know I have type 2 diabetes. I'm aware of that. But it wasn't all I am.
It's not your identity.
It's not my
something
identity.
you're experiencing.
Exactly.
Yes.
Exactly.
Tell us a little bit about how things have improved. We had another member, I'll paraphrase the quote, he said his A1C was dropping like it's hot. I love that quote from our other member, but your experience, how is that being managed now?
So, although my A1C was in the great range at 5.8, and I worked very hard to get
I
there.
love how she knows those numbers.
Yes, I do.
That's a powerful also statement as a member to know that number.
Well, when I started this journey, so for me, just brief history, there's no one in my family who has hypertension. There's no one in my family who has diabetes. We are very healthy folks. I did not get hit with diabetes until I was on the precipice of turning 50. So it was a shock for me, and I was extremely angry at the diagnoses because I couldn't figure out how it happened.
How you get there, yeah.
What happened? When I got diagnosed, my A1C was so high they couldn't register it. It was above 13. It was like, we're like, we don't know what it is.
Wow.
The doctor looked at me and she said, I didn't expect you to be in this condition, because I was sitting in the hospital. I knew something was wrong, but I didn't know what it was. And I was just sitting there talking like I'm talking now. And she's looking at me like, how are you sitting up talking? So I worked hard to bring it down, but what was so impactful with Seeing Health, and I thank CareFirst for being forward thinking with this and being symbiotic, because it's a symbiotic relationship.
Yes.
The pharmacist, I was telling the pharmacist what, and talking to the pharmacist. You know, usually you think pharmacist, meds, hey, can I take this with this? You know, something instant. But this pharmacist was actually looking at my profile and saying, hey, by the way, you're on galagliptin metformin. You're taking Trulicity. The dose that you're at is not therapeutic. It's not working for you. Where's your statins? Where's this? Where's that? And I'm, you know, sitting there mesmerized. It became empowering for me. So I went back to my nurse practitioner and said, hey, by the way, the pharmacist said, I need to be on this. You need to take me off of that. You know, that's invaluable.
Yeah, I think it's a testament to you have a team that's backing you up so that you can be your own best advocate.
Yes.
And navigating this system is complicated.
Yes.
I try to help my parents, and I'm in insurance, and they turn to me for those things, and it's still complicated. Mm-hmm. So that, I mean, I'd love to hear, Shantrease, your experience with having Seen in your back pocket. How did that work for you? How did that help you in your journey?
Made me more aware and focused on me, because they were focusing on me. So who else can I focus on? Like, oh, me. Maybe I should do me as number one. But the calls and just a little private cheerleaders. So, hey, you did this, which your doctors, nurse practitioners are, to me, churn and burn. Like, get you in, get you out, keep it going. Get you in, get you out next. Get you in, get you out. But they were, get you in, get you out. Hold up. You have any questions? Seen actually told me to contact my doctor, because I, type 2 diabetic, but hereditary. I've had diabetes for, I think this year, they told me 25 years.
Oh, wow.
But I have every hereditary medical condition on both sides of the family. I'm asthmatic, I'm diabetic, you name it. I have every doctor from head to toe, but I listened. But I was always the caregiver, which I took everyone to their doctor's appointment, made sure you took your medication, put it in the medicine bottles, for, you know, the daily dosage, yes, so you'll know what to take and when to take. But when it came to me, I was a bottle. Let me take this one, I gotta take this. But I was so organized for everyone else. But for me, it wasn't. So they made me, without even knowing, get a pill organizer for myself, something as simple. They were like, did you take your medicine? So instead of dumping pills in my hand and then showing them and doing the video, I would do little stuff. And I was like, yeah, look, that was a little win, a little $1.25 pill organizer was a win because I knew I had to report it. I knew I had to show it. And it was like, wow, thank you. You little things with me because I was the one that did the big things for everybody else. So to do this for me, it's like, yeah, okay, you can do something for yourself.
One thing that strikes me is that, Dawn, when you were talking, it seemed like a luxury to have a pharmacist that you could talk to.
Yes.
So it actually brings up a massive problem we have in healthcare, which is how is it that if you have a serious chronic condition, it's a luxury to get to talk to somebody for an amount of time, enough time to describe the problem and find solutions. And as we were talking earlier, the provider visits are now very short. It used to not be that way. Providers sometimes made house calls. Length of stay in a hospital used to be measured in days, not hours. And so we have a lot less time in our healthcare system now. And so there's almost like no choice but to deliver care in between. And it reminds me, I think you said it best earlier, Shantrease, you said, oh, old is new, right? Because I would argue that while we use a lot of technology to deliver this solution, what it actually is just facilitating two people talking together in a very convenient way. But that's also what you're talking about is not new, right? The pharmacists have existed for a while,
forever.
as have providers. But perhaps you can tell Shantrease, that comment, old is new.
Yes, well, my grandparents used to say how the doctors would come to your house and make a house visit. Now you can't get them to come to your neighborhood, but this now is a combination of this is our house visit. The scene was my house visit. Now I still went to the doctors, but when the team would call me, if I would tell them something, they would be like, well, you need to call your doctor and tell your doctor this. Because I was like, they don't have time, I'll figure it out. And they were like, no, call your doctor and tell them. And then next time I checked in, or in the portal, it'd be like, did you talk to your doctor? And I'm like, yeah, my doctor said do this, this, and this, and this, and they gave me this. And I'm like, oh. So I was raised, when I was little, the pediatrician came to the house to see me. I didn't start talking until I was like 6. They said I went for hearing testing, everything, but they said, she doesn't talk because she doesn't have to. You speak for her and she points and you give her everything she needs. So I wouldn't talk neither, it's all I had to do was do that. But this was the pediatrician came to the house and was like, my grandmother told me, he said, leave her alone, she'll stop talking. And they wouldn't give me everything I pointed to. They made me say juice, soda, water, apple, orange, and that's how but they used to come to the house and they were trusted more because you got that. You walk in, like we said earlier, you walk into someone's house, there's somewhat, you can't be super robotic when you're in someone's house. Like they're gonna offer you want a glass of water, you wanna sit down. When you go in the doctor's office, you sit on the crinkly paper in the cold room and wait for some cold hands to come and see you.
So true. The time in between is such an interesting comment because, and I'm sure you all are familiar with this, we've been talking a lot about the push to primary care, building primary care access. When we know so much of the care happens and addressing the social drivers happens outside the care setting. So where are the other opportunities for us to create these points of access in the community, whether virtually or in person, that allow us to get you when it's convenient for you, especially in an environment where convenience and that commercialization, and we've come to expect that should be that way, and everywhere except for our healthcare system. So it's an opportunity for us to hit the core of our mission, which is to expand access, affordability, and quality, and we get to do that with partners like SEEN and others who give us access points where we may not be able to reach you or where it's not convenient because there is no primary care in an accessible place for you. So I mean, some of the technology pieces here, I want to highlight, Sebastian, how that's come to evolve, how you are thinking also about the development of AI as we think about all these things too.
Right. Yeah, so we've tried because we're video recordings, right? We have tried video banks where the response you would get would be pre-recorded. And these have been massive failures because you need like an extremely excellent actor or actress to pull that one off. And you can even dub people's names into videos. There are video avatars out there. we're interested in automating all non-critical work so that our nurse, pharmacist, health coach can do one thing, which is talk to you, right? And talk to you intelligently without missing something important, which becomes, I used to think that so the program can be 60 to 90 days, so I used to think if somebody got to like past the 60th day, they're on autopilot, they're taking their medication, we've resolved all these problems, we're gonna have lower costs. It's actually the opposite. The more information that comes at us, the more we're responsible to respond and not miss the fact that, your cat's really sick or whatever it is you said.
Right.
And if we miss it, we could destroy trust.
Right.
So for us, AI is simplifying the work of the health coach, the work of the nurse, so that they can actually have a good conversation, but one that is meaningful as well.
Right.
So there's a lot of AI that happens in the background, and it's amazing what's out there that you can just plug in to your system. But the human interaction piece is core, and you can't take it away. We don't know a way to take it away, and I don't think you would want that either, right?
It's kind of like, if I may say this, if you go to the supermarket or any store and you have the self-checkout, right? That's instrumental so that you can just kind of get in and get out.
Right.
But what if you have a problem with an item? Now you need somebody to come in and intervene for you.
Right.
And that's what Scene does. So if you have, your Medicare it's streamlined, but then if you bring Scene into it,
Yes.
it's your checkout system. You mentioned my cat, so I'm laughing because my cat was sick, and I remember getting on the video chat, and I'm talking to Nurse Ashley, and I'm like, yeah, hi, I took my medicine. I'm a little sad today because my cat, I just spent $500. Like, I'm going on a tangent off of everything. I did my medication, but she actually listened. And I'm also ADHD, which is a new diagnosis about 3 years ago now. So I'm talking to her about everything under the sun. Like, I'm trying to cram all this into a 5 minute. It doesn't have to take 5 minutes, but like, my mind tends to go long. I'll just put it that way.
Right. But that's good. You control the stop button,
Yes.
which is really cool.
Yes.
Versus the 15-minute, 20-minute appointment
Right.
where you don't have that.
I don't have that. So if I start going off on a tangent, the doctor's like, okay, that's great. So meanwhile, here you go. Here's your medication. Goodbye. Thank you. And we'll see you in 3 months.
Right.
Nurse Ashley comes back. Oh, I'm sorry about your cat.
Right.
Oh, ADHD. Let me look at just really personalized.
On the entrepreneurship side, adherence solutions have been tried nonstop for the last 20 years. And everybody starts with, how do we automate this whole thing so that we know that somebody took a pill? Everything from swallowing an electronic pill to smart containers that send signals. And the fact is, nothing actually has worked except what's done in the hospital, which is you sit with somebody to know that they took it and it's the right medication. Right. Which is why I was so, I didn't know that our team I didn't know that you used one of these plastic pill containers. Fact of the matter is, we could be selling digital containers and all sorts of other plastic junk, right? But this $1.25 solution is really excellent for organizing medication.
And more importantly, what you need.
Right.
And it's what you need at the time. So, so in a lot of ways, there are things you apply technology to and things you don't.
Right.
And I understand and I appreciate technology is the future, but don't forget the past. So this allows both. So you have technologies, you can do the video, leave it of taking the medication, and you can also type in questions or comments, but then you also have it coming back, and then you have the phone call where you talk to a human being. I never want to get to the point where I don't have human contact, be it telephone or you could skywrite me a message. I don't really care, but I know it came from a person.
Right.
It came from a person. So I understand the future is technology, but don't forget the past. And this
Dawn
puts them
even
both
remembers.
together.
I love that you remember Ashley's name, for example, and your
Love her.
yeah. But when you were talking about community, I think one thing CareFirst has really done is absolutely focus on community. So you had started by saying, well, did you pick up that call? And actually, sometimes people don't pick up the call. There's a lot of people we can help. They're not going to pick it up. Or they hear our pitch, which has got to be really good, right? Because you want somebody to video themselves, right? That's an unusual thing. It used to be even more unusual in 2012 or 2013. Then, thankfully, social media came along to make it a lot more
palatable,
acceptable. But it doesn't always work, and there are so many solutions that you're putting, including community centers.
Yes.
And
yeah. I would say we are in the relentless pursuit of connection. Connection with community, connection with our members, connection to positive. I mean, you name it, it is a relentless pursuit of that, and it's to do it better and get to you faster and at a time that's convenient. And so, on our panel yesterday, we also had Wider Circle and a guest there too, of one of our members, describing her experience and her journey and the power of connection. And we've talked a little bit about the building of trust. So what helped build that trust over time? And I'm curious also the accountability that was created during that relationship.
Definitely made me more accountable.
Yes.
I broke my neck to do these videos. It could have been 2 o'clock in the morning, and I'll look and say, oh my God. And then I usually would get on, I'm so sorry it's so late, but here's my video, and blah, 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 and I'm making sure the lighting's good, and I'm making sure you can see me. Like ironically, it's spotlight. It is your spotlight. It is your time to shine. And I don't think many people get a chance to do that. We're told that it's not supposed to be about you.
You're put at the center
You're put
of
at the
this.
center
Yes.
of the whole thing. For me, the care, it almost felt like, and I hate to use this term because we tend to use family a lot, right? And sometimes, families can be very dysfunctional, but this was a true sense of I belonged. And you mentioned community and connection.
Yeah.
I felt a connection with Nurse Ashley, with Coach Amrita, with the different Nurse Belinda. I felt that connection. In fact, I think it was Nurse Liz who actually said, I normally don't show my face, but I'm gonna show you my face today, And I was like, oh wow, that's, she came out of her comfort zone. For me, for little old me, I'm just a member, but it was more than that. And making sure that not only did I take my medication for my type 2, but now I'm remembering to take my ADHD med, which is something that, I still struggle with, but I got better with it. It became more natural. It's just like a part of every day, just like brushing your teeth, washing your face.
Incorporated into your lifestyle.
Exactly.
Yeah.
So I'll sing those praises forever. In fact, after the program, I still do it. The program's done. I'm still there.
Still going.
Yeah.
Still going. Shantrease?
Oh, yes, the accountability. Throughout like I said, I buried, 5 people in 6 months, and I just kept going, and everything was robotic. I'm like, I'm taking this pill, I don't know, I don't care, I got so much going on. Oh, I'm gonna take this pill. I kept my doctor's appointments and I kept taking my medicine, but I felt no purpose or no benefit. I did it because it was what I was supposed to do. And that's all every doctor was like, are you still taking your medicine? You've been through a lot. And I'm like, yeah. And then when seen, it was like, are you still taking your medicine? You've been through a lot. What are you doing? It's just coming from seeing the you felt more personable.
Yes.
And I was like, oh yeah, I'm doing me. I'm doing this for you. In the time frame, it's been times when I forgot the video. And I'm like, oh my gosh, I beat up myself. No one ever said, Shantrease, your video's late, early, whatever. Right. And I was like, oh my God, I can't let them down. I can't not do this, even though I'm doing what I'm supposed to. But it was just the opportunity to go, okay, let me take this medication, and someone is looking out for me, because I was the one looking out for everyone else. So to be a caregiver, now you were giving back to the person that cared. So I was like, oh, okay, they care for me now, la la la. And the 5, 3, 4-minute videos were my time to shine, because I was like, someone's gonna look at this and they're gonna acknowledge me, that I'm doing what I'm supposed to do, because I look out and make sure that everyone else. And sometimes it's just that cycle feels so good, and you don't know you need it until you got it. Like I didn't know. I was like, I can do this.
Did it surprise you to hear that this was a benefit? Because we've been talking about,
It did.
especially in the context of
It did, yeah.
the federal environment and potential budget cuts ahead and preserving these programs. Tell me about your initial reaction to hearing this.
When I was told that it was first thing I said was, how much does it cost? Because everything has a cost, right? That's what you're told. And I remember Farhana, that's her name, she told me, she said, no, it's part of your CareFirst. I said, CareFirst is paying for this? Oh, okay. All right. I've never heard of an insurance company doing this before. This was new. I've never known, unfortunately, insurance companies, the perception is that they're cold. They care about their bottom line. They're a part of this? So it was refreshing. It gave me a different perspective. I'll be very, very transparent. It gave me a different perspective of CareFirst, of insurance.
Yeah.
You know, especially being a former medical professional myself and working on that end, trying to fight with insurance companies, to see them actually care and say, let's do this benefit. Let's here, we want to help you, we want to empower you. My kudos, I will always sing the praises.
Appreciate
The
that.
hardest part was getting over the cost, because everyone's always calling you, soliciting you. They may say it's for your good. Well, for $29.95, we can do this for you.
For the low cost.
It's always, for a one-time fee, we'll do this. And I'm like, so that's why the initial call was like, okay, let me see what she's trying to sell
Just
me
try for
now.
30 days.
Yeah, just try. You can cancel it.
Cancel
all
anytime.
Give me your card number. Oh, you don't have to give the card number at this time. We'll bill you later. What's your address?
That's
And
become the expectation.
Yes.
So that's why I believe more people would do it if you got past that initial. But so many people are trying to sell you stuff. You get so much junk mail about your Medicare, your medication, or your this, your that. So it's to get through that. Me being a Weisenheimer, I was like, let me see what she's going to tell me. I want to see what she has to say. Because you get so many calls offering you this or telling you that a day that you have to take the time to weed out something. It might be some truth and some benefits weaved in there. And that's with the scene. I took the scene call, was like, okay.
Cutting through the noise is super challenging for us as a payer. Super challenging. And I think it really warms my heart to hear how much this solution has helped. Of course, there is the ability for us to be able to meet the metrics, if you will, which is the necessary element. But we get in Medicaid it's ripe for innovation. We get to do these types of programs, which gets me so excited. And we say, like, once you're in Medicaid, it's really hard to leave because there's so much you can do, and it has such a mission and core element of really supporting the folks that need it the most. And that's why we're doing this. It's the right thing to do, and it's the sensible thing to do this.
Yeah, at the same time, I'd say that it's not a charity either, and the expectation that is put on us and that we set on ourselves is there isn't really in the Medicaid space a value placed on just having somebody take their medication. There are a few measures that get there, and that's not why we do what we do. We do what we do because if you have a chronic condition and you're prescribed medication for the condition and it's not in control, you're going to end up in the hospital.
Exactly.
And so the metric of success for us is help people take their medication so that they don't end up in the emergency room or the hospital.
Right.
So the fact is that it's great for me to be able to say that. We also have to be able to calculate that.
Yes.
Right?
Yes.
You have to be able to show that in an accepted methodology of calculation, the fact is that yes, when people take their medication, they don't end up in the hospital.
Right.
So we have been very, very data focused. Lucky that CareFirst was like an incubator for us initially so that we could get it wrong a few times and then eventually really get it right and know, okay, this is the right group of people for this program. They're going to benefit. They need it. And if we can succeed with this group, they will end up in the hospital less, which is great for CareFirst, great for us,
Great for us.
members as well. So metrics matter, but there's got to be a reason for it. But you got to, I think for each of your programs, you're selecting like, okay, what is the right fit for this particular program?
Yeah, it's the interventions, right? We want to be able to get to the populations that need it and the members that need it. And so that's why we work with different partners and try to plug, evaluate. All right, lightning round. As I think we're coming to a close, I don't know if anybody can give me a quick time check. What is feedback, or what would you say to another member to take the call? What would you say?
This is your life. This is your chance. You get one shot. Take the shot. Take the shot. It's not going to hurt you. It'll only benefit you. It'll only hurt you. But you have to take that shot. So we're afraid of taking risk. Take this. Take this risk.
A moment will save you a few minutes. Just take a moment to answer. All I did was answer the phone and listen to her. Even though I've gotten several calls, I still was like, let me listen, see what she has to say. And again, it was no initially, and then she was like, oh, come on, just try it.
Just try it.
you don't have to. I was like, okay. It was like, okay, she sound sincere. It didn't sound scripted. So just take that moment for a few minutes and you can add on to your life.
I love that.
And that's the same every day as well, right?
Yep.
Every day, it's not that hard, right? It'll take a few minutes. Can I lightning round real quick? Is there something that you learned in particular on the medication side or on the health side? Were there things you think you didn't know before that you did learn?
With me, it was a medication, like I have a lot of hereditary things on both sides. I've had heart stents, asthma, diabetes, and I'm the athletic one, the bake your own food, nothing's fried, but I still got everything. But some of the medication I was taking, they were like, take it at night, take it in the evening. And I was like, okay, I'm one of the ones, take it all in the morning. They were like, no, take this at night. And I was like, I've been on that for years. No one ever said that. And then there was another medication, you should be taking that once a day. Well, they told me twice a day. And I've been on it for a while. Called my doctor and they was like, yeah, you can take that once a day. Well, why did I have to have a pharmacist outside of it? I've been your patient. So it made me look at medication, my medication differently and question it. No matter if I've been on it for a week, a month, a year, 4 years, I still go back, do I need to take this pill?
Right.
What does it do? What should it do? And I'm like, okay, I got that. I did it for everyone else, but I never thought to do it for myself. Seeing made me see, okay, do this for yourself.
Right. It's important to know.
Yes.
Right. And Dawn, when you answer, you can also tell us what you taught us, what you taught Nurse Ashley about.
Oh, there's two things. So the first thing is what you guys taught me, what Scene taught me was about statins, because I have great cholesterol, my LDL, all that, perfect numbers, but didn't realize that because I am type 2, that's still a danger. Yeah. And the pharmacist was like, and I'm like, well, I don't really need the statins. I'm okay because and she's like, well, actually, so she was firm, like, wait a minute, lady, hold on. No, you need the statins. So I was like, okay, okay, let me back up a little bit. And you're saying what I taught you. I think what I can teach people is the fact that personalization is so vital. Nurse Ashley, I told her about, because I'm ADHD, I hate eating, and I'm a diabetic, so I have to eat. So it's that weird circle. I could go all day, 2, 3, 4 o'clock, and not have a drop to eat, nothing, maybe some water. And I found out that my ADHD causes me not to want to eat because I get bored with food, and I will get bored with food quickly. Now, it might be partly because I'm a native New Yorker and used to great food. I don't know. Jury's out on that. But I told Nurse Ashley, I said, hey, I just discovered that because I am ADHD, that's one of the reasons why I don't want to eat, that executive dysfunction. I don't have it where I want the drive to eat. And she was like, I never heard of that. Wait a minute. And she went and looked it up. She actually went and investigated it. She didn't have to. That's not part of what I was here for. I'm here for the diabetes, right? She came back, she said, you're right. Let's find some ways to make, maybe we can make some food choices or just introduce you to different things that make you want to eat. So that was very important, that you listen to me. You actually listened to what I had to say. You didn't treat me, because when I told the nurse practitioner the same thing, I don't know about that. I mean, I don't understand why you don't want to eat. I mean, it's food, you have to eat, I got that, yes, food, must eat, got it, life, I understand. But, listen to me, and that's what she did.
You might have felt seen.
Yes. There you go, Sheila, you got it.
Thank you both so much.
Thank you.
For your time, for being here, for sharing your story, because that is a very personal thing to share, and for giving us your feedback and perspective. I'm going to open it up in case there are any questions. I know we went probably a little bit over time. We have 3 minutes? 3 minutes over time. Jane.
We talked about the process of like saying yes to phone call. I'm sort of curious, you were an early adopter of the service. Like, so many vendors are trying to sell you stuff.
Yes.
How do you pick this? How do you make a decision?
I also always usually take the call when it comes to vendors. I'm a very curious person by nature, and I think our organization has a motto of staying curious as well. And so when we look at partners like Scene and or others, I'm looking at also data on my end to see what problem we're trying to solve. I'm taking that and then I'm talking to folks to understand what solutions are out there. There is no one solution that is one size fits all. It's going to have to be a series of almost like a puzzle piece that comes together to create something that works, especially as we serve the state of Maryland. It's different needs across different regions, rural, urban, what have you. And so I believe in the concept of fail forward, fail fast. And of course, in healthcare, data takes time to come in, claims take time to come in. So I'm usually looking at a pilot. What pilot can we do first? 6 months, a year, let's understand what it looks like, and then modify and tweak from there. So I'm very excited because with Scene, we're also evolving to offer it to our other lines of business, including DSNP and others. And so it's a result of having understood the impact, tweak it a little bit, get the feedback from members, get the feedback from Scene, what are we seeing in our data, and then now continue to scale and expand. So that's how I and we start to think about innovative solutions and pilots with the population. Great question, thank you. All right. Thank you so much, everyone, for coming. Appreciate your time.
Thank you.